It's my pleasure this morning in this boardroom to be signing an MOU between the government of Kenya and the WHO regarding the establishment of the WHO Emergency Regional Hub, which has been long overdue. This is indeed historical and momentous occasion for this country and the African region at large as we continue to work towards strengthening our health systems and improving our response to emergencies and disasters. Let me begin by thanking the Director General of WHO, Dr. Tedros, who I know you are representing him here today as the country director, for the decision to establish the regional hub in Kenya, being the third in Africa. As we are all aware, we are faced with increasing number of health emergencies, ranging from disease outbreaks such as the one that we are at the tail end, hopefully, of cholera. And there is an outbreak in our neighboring country, Tanzania, which has a significant risk of spreading to our country. These emergencies pose health, social, economic, and security risks that threaten to reverse the years of health development progress in Africa. Ladies and gentlemen, as we have all witnessed over the past 3 years, COVID-19 pandemic highlighted the critical importance of preparedness and response in the face of health emergencies. One of the biggest challenges that the government of Kenya faced in the response was lack of essential commodities and products such as PPEs, and this was mostly due to the global supply chain challenges, and also we faced a vaccine apartheid. The government of Kenya appreciates WHO as a valued partner to the Ministry of Health, particularly during this time of COVID, and in strengthening our in-country systems and structures for emergency and preparedness and response. And to thank you also, Dr. Diallo, for the recent support that you gave us as we handled the unknown disease in Kakamega. We appreciate the continued collaboration between the Ministry of Health and WHO in developing disease-specific contingency plans, including viral emergency, hemorrhagic fevers, pandemic influenza, cholera, Rift Valley fever, and polio. Ladies and gentlemen, the government of Kenya recognizes and supports the new innovative initiatives launched by the WHO to improve the capacities of African countries to respond in real time to increasing numerous and complex health emergencies. It is in line with this that WHO Regional Office for Africa sought to strengthen and expand the WHO Emergencies Hub in Kenya to coordinate high-quality responses to health emergencies in Kenya and other Eastern and South African countries. It is envisioned that this hub will serve as a modern storage facility for essential medical equipment and consumables that will ensure timely logistical support to countries within emergencies in Eastern and Southern Africa. The hub will also be a center of excellence specialized in capacity building in health crisis and emergency management. An expanded and more versatile emergencies hub in Kenya would allow WHO to effectively and swiftly support Kenya and all Eastern and South African countries by maintaining stockpiles of medical and logistical supplies, onboarding and training multidisciplinary teams of human resources to serve Africa's elite emergency experts, and stationing WHO health emergencies professionals to ensure quick deployment during public health and humanitarian emergencies in Kenya and in Africa as a whole. Through this partnership with WHO, we will have access to the organizational global network of experts, knowledge, and resources. We will also be able to leverage on the latest innovations and technologies to improve our response times and our ability to provide essential healthcare services during emergencies. Furthermore, this hub will enable us to build on the progress we have already made towards achieving UHC. We are committed to ensuring that every Kenyan has access to quality healthcare, and in this partnership with WHO is a crucial step towards achieving this goal. The hub will also enhance our ability to coordinate with other countries in the region, and through partnerships with the regional bodies such as Africa Union and the East African Community, we can improve our collective response to emergencies. Ladies and gentlemen, the MOU sets the framework for cooperation and understanding between the government and WHO and determines the general terms and conditions towards the establishment of the hub. We are committed to working with the WHO and the regional partners to strengthen our health system and improve our preparedness and response to health emergencies. The establishment of this hub is a significant step towards achieving that goal. As I conclude, ladies and gentlemen, I congratulate WHO for this great milestone and having confidence in Kenya government to undertake the task of making this hub a reality.
Representing the regional director, Dr. Mweti, who I believe has already called you or will call you on my way here. She confirmed your contact information, but also representing the Director General of WHO, Dr. Tedros Ghebreyesus. CS, like you said, today is a big day. Today is a big day, and Kenya once again illustrated itself as a leader in global health, as a leader in making a difference in health in Africa. So on behalf of the Director General and on behalf of the Regional Director, I would like to congratulate and thank Kenya. Congratulate Kenya for a number of things. CS have met with you many times. As part of the UN family, I also met the Deputy President. In all those exchanges, your message has always been clear and consistent. The government of Kenya has prioritized health. You've always mentioned universal health coverage as a key priority for this government. So we would like to congratulate you for that and reassure you that WHO will be by your side while unpacking your universal health coverage package. And by bringing this process to fruition, you once again demonstrated your leadership, your commitment to making a big difference in the health of Kenyans, in the health of Africans. This emergency hub, like you said, and like my colleague Adama said, is going to make a big difference. And to go into the specifics on my way here, Adama was reminding me the level of commitment of the government of Kenya, just to mention some monetary values. The land that Kenya committed to this initiative is estimated at $26 million. Kenya has announced $5 million contribution to this project. In addition to that, the offices that we were given within the Kenyatta University Teaching, Referral and Research Hospital are also estimated at roughly $1 million a year. If you put all that together, it takes us far. It's about $32 million. Like you said, it's unprecedented. It is really, really worth mentioning. It is going to make a huge difference in saving lives in Africa. And it's not all, because we have the press here. It is the opportunity to mention, again, Kenya's leadership in this space. There are other similar initiatives that Kenya is engaged in. The Regional Center of Excellence for Assistive Technology, that is also going to make a big difference in people's life. It is all about assistive technologies such as eyeglasses, hearing aids, prosthetic limbs, these neglected things. And again, it demonstrates Kenya's commitment, Kenya's leadership in that. Another initiative, Your Excellency, that you're engaged in is just this alternative to tobacco growing. Kenya is leader in that. In Migori County, growing tobacco is being replaced by growing high iron bean, and it's so successful that Kenya is proposed to host the global celebration of World No Tobacco Day in Migori County. And again, it speaks for Kenya's leadership in this space. Internationally, it is the same thing. Last year, Kenya chaired the executive board of WHO. I think any Kenyan would have been proud to see the excellent performance that the acting director general did on your behalf, on behalf of Kenya. Everybody recognized his leadership, the way he handled the debates, and his knowledge of global health issues. I mean, any Kenyan would have been proud. And again, it illustrates Kenya's engagement and commitment in this thing. Not to mention your direct involvement in the intergovernmental negotiating body for international health regulation. So without being too long, I would like to take this opportunity to thank you, to thank the government of Kenya for its leadership, for its commitment to this project. It has not been easy, it's been a long way, but it happened because you wanted it to happen. So it is an opportunity to thank your entire team, Your Excellency, that has been involved in this process. You mentioned it, Dr. Kuria and team under the leadership of the Director General, the PSCs, and yours, has directed this process with a huge commitment.